This is Diane Gertson with Texas A&M AgriLife Extension Service in Fort Bend County. Today we will be talking about managing diabetes during stressful and irregular times. We'll be talking about tips that you can use to keep your diabetes on track. We'll go over some practical tips to consider during stressful or irregular times of diabetes management. We'll talk about the items that you need to have on hand, what you need to do to keep your blood glucose in check, focus on keeping foods in your plan, staying active, and above all, being flexible. First thing that you need to do is be prepared. Make a list of things that you use on a regular basis. This will help to make sure that you are not hurried when you are looking for your diabetes supplies. Also, talk to your primary care physician to ensure there are not additional items that you may need during regular or disaster times. Also, to make sure that you are prepared, there are some items that you need to make sure and have a 2-week extra supply. Your medication. Having that 2-week supply helps to make sure that you have enough medication when supplies may be unavailable. You also need to have 2 weeks of your blood glucose monitoring supplies. This is your lancets, test strips, and batteries that will allow you to keep monitoring your blood sugar on a regular schedule. And then some shelf-stable, quick glucose sources in case of low blood sugar. You can have the glucose tablets, regular soda, fruit juice, or hard candies. They can be stored without refrigeration. Another tip is to create a checklist of the items that you use on a daily or weekly basis to have those as part of your diabetes care plan. You may want to check in more often. Stress hormones can change your body's response to your blood glucose, causing your blood sugar to be either higher or lower than normal. It's recommended that people with diabetes check their blood sugar more frequently during these times to make sure that their blood glucose is staying in the recommended ranges. As a reminder, the blood glucose levels should be 80 to 130 before and in between meals, less than 180 2 hours after a meal, and 90 to 150 before bedtime. These are general recommendations for those with diabetes. You may want to check with your physician because your physician may have different levels that they want you to keep your blood sugar within. During irregular times and stressful times, you may not have access to foods that are part of your everyday plate. Using the plate method is a visual tool that someone with diabetes can use to make their plates when they don't have access to normally prepared foods. This may not always be perfect, but choose foods as part of a healthy plate that can help in managing your blood glucose during stressful times. While every meal may look different, trying to get your plate as close as possible to the plate method is the best option at hand. Here is how we create a healthy plate. 1/4 of the plate is lean protein, 1/4 is our starchy vegetable or grain, half of the plate is our non-starchy vegetables, and then we add a serving of low-fat dairy and or fruit if it's available. Remember, all forms of vegetables count, fresh, frozen, or canned. Some non-starchy vegetable options include asparagus, beets, Brussels sprouts, cabbage, carrots, cauliflower, green beans, mushrooms, onions, peppers, salad greens, summer squash, tomatoes, and turnips. Another tip, being active not only helps with managing stress, but can lower your blood sugar for up to 12 hours. This can help when a person does not have access to normal foods. All movements count to being active. So what types of activity do you like? You can get outside. Go for a 15 to 30-minute walk or run. This helps to get fresh air and sunshine. Log on to an online fitness site or find a video on YouTube to do some exercises. Find items around your home or use your own body weight to do resistance activities. Remember, strength activities count as well. Being active not only reduces stress, but can help to lower our blood sugar for 12 hours. Stressing that because it's highly important. During stressful times, being flexible with your choices is okay. It's looking at the options and making the best choice of what you have at hand. We need to remember to choose whole grains, non-starchy vegetables, and lean protein foods more often. Less often, we want to choose high-fat and high-sodium foods and sugar foods. So, what do you do? If you have different food than normal, choose from the foods that are available to make your plate look like the plate method more often. Are you out of your normal routine? Try to stick to a normal schedule and meal pattern as best you can. Are you tempted by food? Get out and get moving, or remove the foods that might tempt you to not create a healthy plate. Closing with the food for thought. The hardest decisions in life are not between good and bad or right and wrong, but between two goods or two rights. Thank you for joining us today.